to actually join in. It'll take just a teensy bit of time for everybody to connect through. All right. Hi, everybody. We're here at CrimCon in the second day on stream 4. The title for this panel is Public Perceptions of Crime and Justice. A couple of housekeeping things right here at the top. If you've got a question as one of our panelists is talking, hit the Q&A button down at the bottom and type in your question. We'll get to questions at the end of the panel once everyone has had an opportunity to present. Looks like I've got, I can't click and do things. All right. So once everyone's had the opportunity to present, then we'll go through and answer questions. You might not see your question after you submit it, so just know that we have received it, and we'll get to the questions that we can. We may not have time to answer all of your questions. Our presenters will each have 10 minutes. We'll be fairly strict on time, and we'll go in the order that is in the program. So with that, I will shut up. I've gotten pretty good at getting through that quickly, I think, at this point. And we'll move to our first presentation. Our first presenter?
Yep, that's us.
Okay, all right. So student perceptions of the Me Too movement.
Great, thank you very much. Thanks everyone for spending time with us today. Erin Williams and I will be presenting our preliminary results from a paper called Gone Too Far, ? Student Perceptions of the Me Too Movement. We are co-authoring this with Erica Fissel from University of Central Florida and Jill Hoxmeier from Central Washington University. So the idea for this paper came from a couple of places, but what we'll talk about briefly here is the role of social media activism in sort of changing maybe perceptions, and then to what extent can it result in actual change. We know the history of the Me Too movement. The hashtag was first used by Tarana Burke in 2007 to focus attention on violence against Black women and girls. It exploded in popularity in fall of 2017 in light of allegations against Harvey Weinstein, and was used more than 19 million times in the first year post October of 2017. So it's a very visible form of digital activism. And as sexual violence scholars, we wanted to know to what extent undergrad and grad students had, what their perceptions were of the movement. So, there's some backlash to the movement. There's some questions about whether any concrete change will come from the Me Too digital activism. And some has, but what does it mean in the long term? And we also wondered if it affected how people thought about past experiences. And so my co-presenter will be sharing more about our research questions.
Awesome. So we wanted to look at whether perceptions of the Me Too movement differed based on victimization status, gender identity, race and ethnicity, sexual orientation, or the interactions between the identities. So we utilized one-way ANOVAs and a multivariate regression to look at these questions. So the data for the study are from a biennial campus climate survey conducted at a medium-sized, private, predominantly white university in the mid-Atlantic region of the United States, and these data are from March 2019. The tailored design method was used to garner higher response rates, which were 48.1% for undergraduate students and 60.5% for graduate students. All of these were asked on a 5-point Likert scale, with 1 being strongly disagree and 5 being strongly agree. So we asked the students to rate the extent to which you agree with the following statements. The hashtag #MeToo movement has gone too far. The hashtag #MeToo movement has created an environment where those accused of assault or harassment will be held accountable for their actions. And the hashtag #MeToo movement has affected how I think about my past experiences or things that have happened to me. So our first graph is looking at results by gender and victimization status. So as shown by the blue line, the average for the first variable too far is 2.17, with strongest agreement being men without victimization experiences, and strongest disagreement was with women with victimization experiences. And this was statistically significant when compared to women who were not victims, men who were victims, and men who were not victims. However, all responses are in the strongly disagree to disagree category, showing that no group agreed with the statement that the Me Too movement had gone too far. As for the environment variable, the mean for this question is 3.6, but there were no statistically significant differences based on gender and victimization status. Therefore, the groups were pretty consistently neutral on whether or not Me Too had created an environment for perpetrator accountability. For our last variable, rethink, the mean was 3.53, with the strongest agreement being the question of the strongest agreement with the question was for women with victimization experiences, followed by men with victimization experiences. And the strongest disagreement with this question was men who were non-victims, but still with the roughly neutral response. We also found that the differences between these groups were statistically significant. Specifically, agreement was significantly lower for women and men without victimization experiences compared to women and men with victimization experiences.
Okay, so we also ran these ANOVAs by race, by sexual orientation. So just to orient you, as Erin mentioned, the blue line is the full sample average, and our patterns are very, very similar throughout all of these slides for the ANOVAs. Gone too far, again, with one being strongly disagree, most disagreed. Generally, right, on average, they disagreed that it had gone too far. But you can see there's some variation in disagreement, and this variable was statistically significant. And then for whether it, and so for people of color without victimization experience had the highest, going towards neutral, I'll say, but between neutral and disagree on whether it had gone too far. But again, it is not that different substantively from the other responses quantitatively, but it is interesting to see the variation based on victimization status and whether the person identified as a person of color or a white person. Environment, again, very similar across the board. People were pretty neutral. This was spring of 2019. So it had been a year and a half since Me Too. So I'd be interested to see if, in 2021, if they felt as neutral or agreed or disagreed more. And then the rethink past experience, it makes sense that it's higher among people who have had victimization experiences. And in fact, it's maybe there might be an endogeneity issue here in that the people who are indicating they've experienced victimization, it's because it made them rethink past experiences. And that is something we're focusing on in a different paper with these data. By sexual orientation, we see similar patterns where, people, the LGBTO, queer people with victimization experiences most strongly disagreed that it has gone too far. And heterosexual without victimization experience are on the other end here, as you can see from this bar. And then the same pattern for rethink. I did run some multivariate models with interaction terms to incorporate a sort of more intersectional lens, like not looking at these identities separately, but looking them as an interaction, and did not find too many interaction effects. So I'll just briefly talk about this one that we need to dive a little deeper into. Again, these are preliminary analyses that queer women without victimization experience agreed a little bit more than queer women without, with victimization experience, that there's an environment where perpetrators will be held accountable. So we're definitely gonna look more into that as we continue to work on this paper. So in summary, I don't think I need to go into too much detail, but less victimization experience seemed to be associated with well, let's just say more victimization experience seems to be associated with stronger disagreement that it's gone too far. And past experiences and rethinking past experiences and victimization experiences are correlated.
As for implications, so awareness is great, but what will it take for real change to occur? While digital activism may be effective in raising awareness, it may fall short in making cultural changes. We also need more research on how students conceptualize accountability. Perpetrator accountability can take many forms, from punitive to transformative, and qualitative research will be helpful to better understand how students conceptualize accountability. And lastly, we need to look at the long-term impacts of the #MeToo movement to determine whether or not it is actually a movement or just a moment.
Thank you, everyone. That's all we have for today. Here's our contact information. You can also find us on Google or Twitter.
Wonderful. And thank you very much. A reminder while our next presenter gets set up here, if you have questions, hit that Q&A button down at the bottom, type your question in the box. We'll get to those questions at the end of the panel here. Next up, we have Fear of Crime and Trust in the Police, Exploring Neighborhood Dynamics in Central America. Laura, that's you.
Hey everyone, let me get my screen for you. Okay. So hello everyone, I'm Laura, PhD student at University of Miami. The work I'm currently focusing on specifically is how fear of crime, especially within Latin America, has really impacted overall trust in police and even criminal justice institutions more broadly. I'm especially interested in understanding how perceptions of what's going on in the neighborhoods can really kind of mitigate these two outcomes, this fear of crime and trust in police. And what we currently see with a lot of the literature is, we've done a considerable amount of research on, the impacts of fear of crime within this regional context. Overwhelmingly, we see the case that, there's considerable fear of crime. Some of this is tied into, violence, ongoing victimization. But we've also seen work too, and especially Damert's work that I mentioned here, that really kind of illustrates how fear of crime is even kind of more related to other social factors. So it's due to, say, rapid social change that's occurred within, a very short period of time, whether this is through, nuclearization, modernization, urbanization, so many different things that can really kind of impact one's fear of crime or overall insecurities in which the communities in which they're living. I've also seen a lot of work too on, ongoing issues regarding trust in police in the region. A lot of this work especially has been well established by those who are looking either at tough on crime policies that have been utilized throughout Latin America, or also have kind of looked at even more modern approaches such as community policing and how these are often resulting in better trust in police. Of course, we've also seen cases where neighborhood factors have kind of been considered into those overall outcomes of fear of crime and trust in police. So the issue with a lot of the neighborhood factors that have been considered is a lot of them actually aggregate the concepts of, say, disorder or even collective efficacy to more aggregated levels. So it kind of takes out the ability to really understand kind of individual perceptions and how these may, be occurring within the communities and how these ultimately may be impacting, say, one's fear of crime, but also trust in police. So with that being said, my study really is just kind of answering, how is fear of crime and trust in police impacted by, individual perceptions of disorder, but also in this case, perceived social cohesion within a specific neighborhood. I actually used a data set that's already been established. This was a study conducted by Vanderbilt University with USAID called Community-Based Crime Prevention Program. And this was done under a security policy that's often referred to as CARSI, or the Central American Regional Security Initiative. Basically, CARSI is kind of this big security project that looks to increase funding for military improvement, but also things such as policing and community-based programs more locally. So basically, I'm using their data set, and I've included a link here for you if you are interested in learning more about what their project was and what they did. But, to kind of summarize, as we are short of time, really, they had many different neighborhoods across the countries of Guatemala, El Salvador, Honduras, and Panama. basically split these countries into either treatment or non-treatment groups, or treatment groups had some type of community-based program implemented within that neighborhood, versus the non-treatment, where those were kind of like the control group. So what they did is, within these two groups, they usually did, first, pre-assessment to kind of see what the initial perceptions of, fear of crime were, victimization, cohesion, and so many different things that they basically collected in this first assessment. And their assessment especially was very similar to other surveys that have been utilized in Latin America through Vanderbilt University. And again, you can click on that link and kind of get more information about their surveys. But after they did that pre-assessment, over about the course of 2 to 3 years, they did conduct a series of kind of post-assessment, or how things were going through the implementation process. It is important to stress that this was not a longitudinal study per se. They did interview different people during the whole period. They didn't interview the same families. And so with that regard, especially for my study, since I'm not really interested in, per se, did Kersey work? I didn't really consider the pre-assessment factors within my models, and instead I kind of combined those two other ways, simply because I just want to get a basic understanding of how individual perceptions of the neighborhood are impacting fear of crime and trust in police. Again, because we're a little short on time and definitely want to make sure we have room for everybody else, I'm just going to focus on the context of Guatemala for this presentation. If you're interested in finding more about what I'm seeing in the other country context, I'd definitely be glad to talk with you after the presentation. So this is just kind of my basic model, and what's really important to stress here, while I did kind of look at Kersey on how this kind of impacts disorder and cohesion, I did some more of kind of comparing the Kersey group versus the non-control, or the control group. But what we see initially, and what's really important here, is the overwhelming impact that cohesion has actually had on this relationship between fear of crime and trust in police. We've seen, cohesion, or the higher cohesion the one has ultimately resulted in an increase in fear of crime, but has also resulted in a drop in trust in police. So basically, as individuals are becoming, they're talking more, they're kind of becoming a stronger network, it's ultimately impacting their fear of crime. More than likely, and we've seen this in other studies, or because of that constant contact, they're kind of communicating more, what are the issues that are going on within the community, and how this is impacting, one's own feelings about fear of crime. So cohesion is resulting in this increase in fear of crime, but because of this, it's also resulting in a lack in trust in police. So they kind of say, like, okay, we have all this crime, there's a lot of issues going on here, we don't think that the police are really doing anything. But on the flip side of that, and what's really kind of puzzling, especially in these preliminary models, is even with this cohesion, as it's going up, we have more individuals talking to each other. When we look at the direct relationship to trust in police, we still see that individuals are saying, like, okay, I actually have a lot of trust in police. And what I'm trying to figure out, especially with this one, is, kind of like, why are we seeing, kind of the flip side of this? On one side, people are linking fear and they're seeing this negative side, but also more directly, they're having this positive relationship. The only thing I can really think of right now is if we think of, more expressive models of policing, where we're not necessarily understanding or gauging the confidence in police based on the work they're doing, but more on how police are a symbol of kind of greater issues going on in the community. This could basically signify that, they realize that there's issues going on in the community, but they see trust in police as kind of these symbolic things that are basically say, okay, if the police are here, they're going to do something about that. We should go to the police to kind of help with these problems. But the flip side, individuals are also thinking, like, okay, I'm really fearful of the neighborhood I'm living in. Why are the police not doing anything? So we kind of have these two ideas that may be occurring to kind of grapple with. On top of this, if we think of things such as, perceptions of disorder, they see a lot of, problems going on in the community, vandalism, empty lots, gang members. There's a couple different variables I use to kind of gauge this idea of disorder. Ultimately, we see, okay, individuals perceive more disorder in community, they're going to have more fear of crime. And this, again, is also resulting in a drop in trust in police. So they see that, okay, there's a lot of disorder, the police aren't really doing anything, I'm fearful, this is what's happening. So from what I've seen from my other countries, just to give you a little context too, is Overwhelmingly, this cohesion aspect still, I think, has continued to be kind of the big puzzle of my story. Disorder, in some ways, in my other country contexts, are kind of, hit or miss, but overwhelmingly cohesion seems to be the big factor here. So I think I'm running low on time, so I will wrap it up and definitely look forward to talking to you guys after we finish.
Fantastic. Thank you so much. Next up, we have the influence of message framing on public support for safe injection facilities in the US. Just a reminder again that you can ask us questions, hit the Q&A button down at the bottom and type your question into the box. We'll get to it after this last presentation.
All right, thank you. I'm going to turn on the automatic subtitles. They will definitely not be accurate for this presentation, but better than nothing. Okay, thank you for coming to the virtual presentation. My name's Kelly Socia, and I'm presenting on behalf of my co-authors. Our project, as just noted, is the influence of message framing on public support for safe injection facilities in the United States. And in terms of what a safe injection facility, or a SIF, is, a very neutral definition would be a clinic where individuals can go to use illicit substances under the care of medical staff in case they overdose. These places don't provide any drugs, they don't help inject the users, and they're used around the world, Australia, Europe, Canada. They've been considered in the US, but nothing has actually been legally operating. Now, these are controversial, especially in the US. Just one site in Philadelphia that was attempted to open got really close, and then public backlash resulted in it crashing and burning. The Project Safe House, which is the Philadelphia SIF, it was legally cleared to operate, and it was on the verge of opening, but then the community members had a lot of backlash, and the facility's lease got pulled in the 11th hour. So that leads to this project. How can we influence public support for SIFs? Well, we know that labels can influence support for a number of different policies. What you call these facilities can influence people's perceptions and their support. They go by a number of names: safe injection, safe consumption, drug consumption, overdose prevention, sites or facilities. And there's one study by Barry and colleagues that showed public support was higher for a local facility when you called it an overdose prevention site compared to a safe consumption site. And this makes sense because safe consumption site puts the emphasis on the drug use, the crime aspect of it, whereas overdose prevention site has more of a public health framing to it and is focused on preventing overdoses. We also know information framing can influence people's perceptions and support. Now, you can have different ways to frame information. You can have a neutral frame, which would be like that neutral definition I gave you earlier of these facilities. No pros, no cons, just what it does. You can also frame these facilities through, say, a crime control framework, where you're focused on, say, relocating drug use from the streets into the facilities, reducing pressure on the police, reducing other crimes. You can alternatively frame this from a public health perspective, preventing the overdose deaths, improving other health measures, reducing disease transmission, reducing the pressure on EMTs in emergency rooms. And any way you frame it could potentially change the support that you receive. When I say support, it's not just a one-size-fits-all. General support is this kind of fuzzy, vague, would you support these facilities in the US? Not necessarily anywhere specific. The local support question is where you get into the NIMBY, the not in my backyard problems. Would you support these facilities in your own neighborhood? And so that is where the rubber meets the road in terms of these policies. So this is where our current study comes in. We had a survey of 1,200 people in the US as of February 2020. We're using 932 who actually answered our questions, and we randomly assigned respondents of the survey to one of 6 different conditions to receive different types of information based on 2 different labels: safe injection facility, a SIF, or an overdose prevention site, an OPS. And within those 2 groups, they could receive one of 3 different types of framing. You could have a neutral framework where you just get the definition. You could have a crime control framework where you get the definition, and then we follow up with some crime control benefits of these facilities. Or you could have a public health framework where you get the definition and then public health benefits. And so in terms of what the respondents saw, all 6 groups received the same neutral definition, just changing out the label based on if they were a CIF or an OPS group. But these facilities or clinics where blah, 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 the exact definition I gave you earlier, very neutral. Our 2 control groups received just this definition, again, just swapping out the label. And then the 2 crime control and the 2 public health groups received follow-up information that we pitched as being from a Canadian documentary. All lies, but the information was selected from real, actual news articles about these benefits. So the follow-up groups received this prompt. A recent Canadian documentary on safe injection facilities provides some important feedback about the effects of these facilities. Here's a selection of information from the documentary. The crime control groups got 9 bullet points of crime control related information. For example, here's one example bullet point. Tammy, whose son's in prison for drug possession, says these facilities are great. It can help prevent them from committing crimes. The public health groups, the 2 of them, received very similar bullet points. Again, Tammy, whose son overdosed last year, says these facilities are great and can help prevent them from overdosing. And the only difference is that the framework is slightly different, but the names of the examples are very similar. And then you have the safe injection facilities people. The people who were overdose prevention sites got the same information, we just swapped out the label. So that leads to 6 different groups. And then for all of these groups, we then followed up with 2 questions, our outcomes. We first asked, how much support do you have for these facilities in the United States? That general policy question. Once they locked in their answer, we followed up with another question, how much would you support these proposals in your own neighborhood? And that stopped them from thinking about the NIMBY problems when they were talking about the general policy. Support was measured on a -10, strongly oppose, up to +10, strongly support scale, with 0 being the neither support nor oppose. Let me show you the results. So we have our 6 groups across the bottom. We have our main control group who got the safe injection facility label, no follow-up information. The other 2 CIF groups got that crime or public health framework information. Then we have our overdose prevention site groups, the control, the crime, and the health follow-up information. If we look at our first outcome, the first question we asked, do you support these facilities at the US general level? Support was slightly positive, about a 0.4 on that -10 to +10 scale, with positive meaning support, negative meaning oppose. So that's kind of our baseline for the general. If we followed up and gave people either crime or health information, keeping that CIF label, support was higher, not a lot higher, around a 1. But if we changed the label, if we instead called it an overdose prevention site, giving the same definition, the same type of crime or public health information, support was dramatically higher, significantly higher. And so, especially if you call it a overdose prevention site, you focus on that public health perspective, and then you follow up with public health benefits, support was over a 4 on that -10 to +10 scale compared to 0.4, our CIF control group. Looking at the next question we asked, the local information or the local facilities, we assumed there'd be NIMBY effects and support would be lower, and that's exactly what we saw. Support was actually in the oppose category, the negative for the control group, and whether or not we provided follow-up information for the safe injection facility people. But, and I think this next part is probably the coolest finding that we have, if we change the label and we call it an overdose prevention site, local level support goes from being slightly opposed to supportive. Slightly supportive, 1 to 2, but it's supportive. And in fact, all 3 of the overdose prevention site groups, their local level support for a facility in their own neighborhood was higher than our CIF control group speaking about, would you support these in the US generally? That's, to me, just crazy that you can change the label and dramatically improve this local NIMBY level support. So what's it mean? Labels matter. Overdose prevention sites label has more support than a CIF label. 2.4 points more general support, 2.7 points more local support. Information framing matters. Not a dramatic amount compared to the label, but if you note the benefits, it can increase the support levels in certain cases. If you're calling it a CIF, talking about the crime benefits is more helpful. If you're calling it an overdose prevention site, talking about the health benefits is more impactful. And then finally, location, location, location. General support is always higher than local support. That makes sense. The NIMBY effect is real. It knocks off about 1.8 points of support from the general level. And you know, it makes sense. It's easy to support something when it's in somebody else's neighborhood. So what does this mean? Call it an overdose prevention site. Don't call it a SIF. Once you call it a safe injection facility, you've already lost the battle. Support increases when you mention the benefits and you match those benefits to the label, to the framing you're setting up with the label. Just because you have general support doesn't mean you're going to get local support. Again, the NIMBY concerns are real, and you could have slightly supportive general support, but an opposition when it comes to putting them in your neighborhood. And then gauging general support can still inform on local level support. You want to get that community feedback. You want to make sure the stakeholders feel that their concerns are being addressed. Thank you very much.
Fantastic. Thank you so much. We do have time for a couple of questions. Again, you can hit the Q&A button down at the bottom and type your question in. We'll get to as many as we can. Our first question here for the first panel: what do you make of the non-significant results around the environment question? I was surprised by these findings and would love to hear more of your thoughts. And thanks for a great presentation.
I can speak to that. I'm just pulling up the chart real quick. I think I have a couple of ideas about that. So the measure itself, there could have been some measurement validity issues that are associated with that finding. So the measure was: the Me Too movement has created an environment where those accused of assault or harassment will be held accountable for their actions. And so there's a lot of room for interpretation on many aspects of that item. And so I did have a couple of write-in responses where people were saying, you know, wanted to explain further what they meant by their response to those Likert items. So I think it's important to look at that qualitative information and sort of what accountability is. But if you look at the average was 3.6. And everyone, when we broke it up in all the different groups we broke it up in, we're still at around that 3.5 mark. So if 3 is neutral and 4 is agree, it's halfway in between neutral and agree. And so people, and I really think it's that it's only a year and a half out. And what does accountability mean anyway? We've seen a lot of people lose their jobs, but then 2 years later, do they get their jobs back? Do they start a new job? And does someone losing their job end sexual violence? Does it mean someone won't perpetrate that again, right? And so I think we need to have this broader conversation about, you know, the need for transformative justice that actually at some point ends violence. And so I think, so briefly, different definitions of accountability will affect different ways of rating that item. And we might need more time to see more strongly how people feel about that. I think those are my biggest responses to that. Thank you for the question.
And we have a, thank you for the answer. We have a question here for Kelly. I think you mentioned this at the beginning. Has anything like this in the US opened up?
As far as I know, nothing has legally opened up. I know, and Dr. Palacios could probably speak more specifically, but there are potentially these places that are operating kind of, you know, under the table, but nothing, as far as I know, has legally been authorized to open up and has opened up. Wilson?
That's correct, so far.
Yeah, they're getting close. They
Yep.
just got to find a place that lets them, and then a neighborhood that lets them.
Right. And if I may add, that's why we believe that our results are very timely, because labels do matter.
Especially when it comes.
My understanding is there are some, sorry, Kelly, my understanding is that there's at least one or more than one sort of unauthorized facility like this operating in some places in the US, sort of taking their legal risk for the sake of doing harm reduction, and that they've been quite successful, but of course it's hard to study them because they are underground and do not want to be publicized.
Yep. And then think about right now the conversation everywhere about the pressure on public health facilities, the emergency rooms, et cetera. The fact that if you can frame this from a public health benefits perspective, it can reduce the pressure on these facilities. Don't even talk about the police. Don't bring up the crime. You focus on the public health benefits. And I think that, especially right now, could be very influential moving forward. Thank you for the question, Sophia.
Are there other questions for our panelists? Yeah, I do have a question about framing and the extent to which the other panelists think that impacts their work. I think the way that we talk about issues enters into how people think about them. And we see that across a lot of things in criminal justice, right? You know, what exactly does defund the police mean versus what do people hear about it? It's in my area of policing, for example. So I'm curious what the other panelists have to say about how the issues that they're studying have been framed and how that impacts perception. I guess we could start that with Laura. So I keep forgetting that we have to actually name people in in questions like this. Been doing it for months.
Yeah, so I mean, I think in my area, like one of the big issues especially is like when we talk about things such as, you know, are we building trust in the police, or are we, you know, mitigating fear of crime within neighborhoods? A lot of this work, especially, and it's not to say there's anything wrong with this type of work, but a lot of it has been very kind of policy based. Like, you know, are these like community policing programs working? And they're kind of using these kind of very basic measures to understand these issues. And a lot of them aren't considering kind of more of those social psychological issues that are kind of going into that overall fear of crime. Like, it's not just fear of crime is because like you could be victimized, right? It could be a whole host of things. It can be, you know, I'm afraid that, you know, my whole neighborhood is going to get up and moved because of, you know, socioeconomic factors that are happening that are kicking people out. There's so many other things that need to be kind of built into understanding those perceptions and kind of, especially, I guess, within the context of Guatemala, you know, it's very easy just to be like, how is your relationship with police, you know, at this one specific period of time? But especially we need to think about even kind of more historical factors and how that whole relationship with the police has kind of changed and evolved, especially through things such as civil conflict and ongoing wars, and especially how those relations have kind of even manifested themselves in different ways and for specific communities, even in the kind of the current time. So yeah, there's a lot of work that needs to be done in that area and kind of how we look at measuring these, but this is a start, I guess.
Yeah, does anybody else want to chime in there?
I can speak briefly about Me Too. Some other work that I and some of my co-authors are working on is looking at, I suppose it's about framing of Me Too and the extent to which it neglected or neglects currently, depending on if you call it past tense or present tense of a movement or moment or whatever it might be, people with less privilege, people experiencing multiple forms of oppression. A lot of the concrete policy changes that came out of Me Too were like workplace protections, which we all love workplace protections, but if you don't have a job, you don't have a workplace protection. Or if you're working under the table, that policy isn't gonna apply to you or a small organization or something. And so there's some really great work written by many authors of color around needing a more intersectional frame when we think about Me Too. And, you know, we this idea that it's the like white women in Hollywood affecting this, and the extent to which that means there will be social change in other areas needs to be continued to be researched. We have another paper about whether it affected disclosure among people. We had pre and post data of before and after Me Too, and we found that some people there were increases of disclosures even among Black women in our sample. And so again, we want to look into that more deeply if that was, I think more qualitative work is necessary, and that's basically, I present quant data and then I say we need to do qualitative, more qualitative work is sort of my tagline.
Yeah, that's something I've definitely done too, right? That the qualitative work really helps to explain the quant. side of the house. We have another question here. Laura, out of curiosity, with El Salvador's new president, have you seen a shift in community trust with the police? The new president has created new policies that have somewhat cracked down on crime. Do you believe that this has increased or decreased trust?
Yeah, so the data set I'm using currently was finished before the new president came in order, so I'm not going to see it in this data set. But this trend that he's doing with this cracking down on crime is just kind of a continuation of what we've seen in El Salvador and Guatemala. So it just kind of like, it depends on politics at the time, right? You have tough on crime presidents who are kind of pushing this narrative. Then you have other ones who are kind of, you know, soft on crime. So they kind of push more this community-based approach. What I think we're going to see, just because of the way that especially kind of police training and other things have been kind of orchestrated across the different regions, is I think what you're going to see is going to depend on which community they're operating in. So you're going to see some communities where they may still kind of have these very tough on crime approaches, and therefore the police are going to kind of be, you know, tougher in their neighborhoods. And this may, of course, in the end, result in kind of negative impacts on how individuals kind of relate with the police. And some work that's kind of compared, especially say like community policing versus, you know, these mano duro approaches, has found that usually in the communities that have had these tough on crime approaches have had far worse relations to police. So I think what we're going to see, and it'd be really interesting to follow up with this study with, you know, a more current one to kind of see maybe long-term trends. I think what you're going to see is going to vary on neighborhood, and it's going to be based on how the police themselves within those neighborhoods are acting. So you're going to see some that are going to be, you know, poor relations because they take that hard approach, and then you're going to have some that are still kind of doing community policing, working with their neighborhoods, and I think those ones you're going to see, for the most part, maybe some a little bit more support for police. So I hope that answered your question. You're welcome.
Any other questions from our audience? While we're giving folks just a couple of seconds to type up questions. If any panelists have any closing thoughts that you'd like to share, this would be a good time. We're running just a little bit early, but I am okay with that. You know, I think this the topics that are brought up in this panel cut across a lot of criminal justice in the way that we talk about it, and so I'm very, very glad to have been in this panel. I would like to thank our panelists for their presentations. This again has been fantastic. The video from this session will be available in CrimCon's YouTube channel as soon as we can get it up. It may be a week or two before we've got it up. If you want to see that, you can subscribe to our YouTube channel, search for CrimCon on YouTube, and you'll find it. Or you can subscribe to our mailing list at crimcon.org. Just scroll down a bit and you'll find it. We will continue having a series of panels and roundtable discussions across the 4 streams here at CrimCon for a few hours yet today, and then again tomorrow. If for some reason you managed to get here without going to crimcon.org/program, you can go there and see everything else that we have going on. You can also follow us on Twitter at crimcon.org. If you're looking for another session that's going to be in this stream, just know that we're going to end this stream and you'll have to rejoin. For boring technical reasons, we're doing it that way. So again, thank you so much to all of our panelists. And this work is incredibly important. We thank you for doing it and for sharing it.
Thank you.
Thank you.
Thanks. Bye-bye.
Bye-bye.